You are dispatched to a family reunion at a state park for a possible stroke.
All right, so arrive on scene. I do my PPE.
Okay.
I do gloves and eyewear.
Okay. Upon arriving, you find a 50-year-old woman insisting that she is fine and does not want to be transported.
Okay. Is the scene safe?
This is safe, yes.
Okay. Do we know the nature of the illness at this time?
Um, at this time, it is unclear.
And we just have the one patient, so the number of patients is still one. There's no additional patients.
It does appear it does appear to be one, yes.
Okay. I probably wouldn't call ALS right now just because I don't know what's going on.
Okay.
The general impression's just a 50-year-old woman with none. We don't know what's going on.
Yes.
If I ask her if she's in any pain or what's going on, does she tell me?
She tells you that she's fine.
Okay. Since her family's there, I would ask the family what happened and try to get some history of the event.
Sure. The family members state that she had been complaining throughout the morning of a headache and feeling dizzy. Just prior to calling 911, the patient dropped her fork on the ground and was unable to move her left side for approximately 5 minutes.
Okay. Is she alert?
She is communicative, yes, so you do deem her as alert.
Okay. So with the chief complaint being that she was unable to move her left side, I'd get ALS going.
Okay.
So let's see, that moves me into my primary. So is her airway open?
She is talking with you,
Yeah.
yes.
Yeah. Okay. And then how's her breathing?
What specifically do you want to know?
Um, is her respirations good?
She does appear to have normal respirations.
Okay. How's her lung sounds?
Her lung sounds are clear and bilateral. You do note when looking at her respirations, they are symmetrical rise and fall of the chest.
Okay. How's her SpO2?
She's currently clocked at 97%.
Move into circulation. So how's her pulse, like her radial pulse?
Her radial pulse comes strong and equal.
All right. And if I was to check that, do I get her what kind of a reading?
If you check her pulse comes in at 84 beats per minute.
Okay. How's her skin?
Her skin appears to be warm, dry, and pink.
Okay. Is there any bleeding that we can see?
You do not note any notable bleeding at this time.
Okay. Transportation. She'd be a high priority transport, so I'd want to get in and out of there as fast as I can.
Okay.
So I would go for sample history. So what kind of signs and symptoms does she show?
She's has a level of dizziness and a headache, and she was unable to move her left side.
Okay. Allergies?
No known allergies.
Medications?
She's currently on Cardizem and Coumadin.
Previous medical?
She claims that she has an irregular heart rhythm.
And what happened as far as the events prior to this?
She was eating lunch. She was visiting her family when the headache and the dizziness began.
Okay. Was there any onset? Can she remember the onset of when this happened?
Approximately 9 minutes ago.
Okay. Does anything provoke it, make it worse or better?
Nothing seems to make her symptoms worse or better.
Okay. What's her quality of pain? I know she said you had a headache.
She describes the headache as a dull, aching pain.
Does it radiate?
She doesn't say there's any radiation of pain. No.
All right. And then on a scale of 1 to 10, what's the severity?
severity, she would claim that the headache is around a 5 on a scale of 1 to 10, with 10 being the worst.
Okay. OPQRS. Has this been going on for a while? Do you know a time frame or anything?
She's unsure of when it started.
Okay. All right. And then I would check for possible stroke. I do a stroke exam, I guess. I don't know what's officially called. I can't remember.
Okay. Doing a stroke exam, you find there's no deficit and no weaknesses noted on either side.
Okay. How would you check her pupils?
Her pupils are pearl.
Okay. Blood glucose.
Her blood glucose level comes in at 84 milligrams.
Okay. And then I would check on her headache again just to see if it's any better or worse or. I guess I'd reassess the pain scale.
The headache pain seems to be lessening.
Okay. I would go ahead and get my baseline vitals. So,
Okay. What do you want to check?
respirations,
Respirations are 18 breaths per minute.
blood pressure.
Her BP is 182 over 90.
Okay. SpO2.
SpO2 is 97% on room air.
Okay. Pulse.
Pulse is 84 beats per minute.
Okay. And then I would I would do a reassessment and check for a stroke exam again.
After a second stroke exam, you notice still no deficit, and yep.
Okay. And then need to get a second set of vitals.
Okay, what are you checking?
Let's see what I have here. Blood pressure.
Her blood pressure has gone up to 234 over 122.
Okay. SpO2.
SpO2 is 95% on room air.
Pulse.
Pulse is 65 beats per minute.
Respirations.
Respirations are 20 beats per minute. Sorry, 20 breaths per minute. Sorry.
You're good. So I would do a rapid transport. I would get her to an ER as fast as I can. I'd position her in I think it's a Fowler's position. And then I would try to keep her warm and reassess the vital signs every 5 minutes.
5 minutes. Okay. Is there anything else you want to do with this patient? Do you have any idea of what this patient might have?
I'm going to assume that she's having a mini stroke. Or,
Mini strokes?
yeah.
Or do you know what else the mini stroke is called?
Transient ischemic attack.
No, you're right. It's a transient ischemic attack.
Okay.
Good job, man.
Cool.